The Secretary of State himself has suggested COVID cases could soar to 100,000 a day once all restrictions are removed next Monday. While research shows hospitalisation rates have thankfully dropped to 3% of cases due to vaccination, this would still mean up to 3,000 admissions, the same as during the first wave. Can he explain how he will avoid such a surge, putting pressure on health services, which would further delay clearance of the backlog of patients waiting with other conditions?
She's right to raise this, as other colleagues have. That of course, as cases rise, which sadly they will, for the reasons I've set out, hospitalisations will rise too. But again, for a reason set out, number one being the vaccine, that the rate of hospitalisation will be far, far lower than anything we've seen before. And she will also know, given her experience, that also the treatments that are available are a lot better and effective than what we had at the start of this pandemic and during the last wave, which is also helping should people sadly find themselves in hospital. It is something as part of the three tests, test number 3, that we've looked at very carefully. We've looked at the data. Of course, we work very closely with our colleagues on an almost minute-by-minute basis in the NHS to make sure that the increased pressure, and I accept there will be increased pressure, I'll be very open about that it will be something that can be met and sustained. And it is important, though, I think, to understand that, because she mentioned the backlogs, that the backlog has built up over the pandemic because people stayed away from the NHS for perfectly understandable reasons. But we do need to start getting back to normal as quickly as we reasonably can, so that we can start looking at more and more people in the longer term at the NHS and actually improve the backlog more quickly than otherwise. And then